The next two antivirals we'll be talking about are used to treat two viral illnesses that are not seen as much in the average population, but when they are seen in their particular population, they can be devastating and even fatal. The first of these is a drug called cytomegalovirus, or CMV. CMV is also a member of the herpes family, and you usually don't see it in the average healthy adult because our immune system can fight it off. When it's dangerous is for HIV patients, and that's when the majority of CMV infections are seen. And also, if a woman gets it when she's pregnant, it can be very harmful to the fetus during pregnancy and cause all kinds of fetal anomalies and eventually fetal death. But the rest of us, just regular healthy individuals, usually can fight that off pretty well. Respiratory syncytial virus, or RSV, is a respiratory virus that can be commonly seen in the winter months. Now, if an older child or an adult gets RSV, you'd usually just think you have a really bad cold or maybe a bronchitis. But it can be devastating and even fatal to infants and very small children. And usually the worst times for RSV are November to March, kind of like the flu season. And that's why it's a good idea to keep children away from large crowds when they're very tiny. I just cringe when I go into Walmart or into the mall and I see somebody carrying around a really, really tiny baby. Every once in a while you'll see a baby that is so little that it almost looks like the family stopped on the way home from the hospital to pick up something at Walmart. And these are the ages where a respiratory infection like this can really be harmful and fatal. So we do have a couple of kinds of drugs that inhibit the enzyme that these viruses need for reproduction. As long as they have this enzyme, they can make more DNA inside cells, and they can keep rupturing the cells and spewing out virions that will help spread this virus. And these drugs can work when used short term just to reduce these symptoms. So on page 96, we see table 6.2, and we have some medications that work well for CMV. They are pretty heavy-duty drugs, and so you wouldn't take them unless you were very seriously affected by this. Many HIV patients get what's known as CMV retinitis, and they can go blind. And so these are patients that need these drugs that will inhibit this enzyme. However, there are a lot of side and adverse effects, and you can read about all the nursing considerations for all these drugs. You can see there's quite a few bullet points for those. There's only one drug for RSV, and it is basically an inhaled drug that helps stop virus replication in the lungs of babies and small children who have it. And they try not to use it unless it's on a particular population. It has to be given by a respiratory treatment, and it's a pretty hazardous drug. In fact, it's said that pregnant women shouldn't be exposed to ribavirin or Virazole. And of course, many of the patients who get RSV, babies, young toddlers, their moms might be pregnant again. And so their mothers should not even be in the room when they're getting this respiratory treatment. Another healthy adult should stay with the child while they're getting this treatment because it can be hazardous. So make sure you read about the different side and adverse effects when it comes to these medications. Next, we're going to talk about some drugs for hepatitis B and hepatitis C. And these drugs are found on page 97 of your textbook. The drugs for hepatitis B virus are in 3 classes, and you'll hear similar classes when it comes to taking care of HIV. There is a category called the NRTIs, or nucleoside reverse transcriptase inhibitors, DNA polymerase inhibitors, and then interferon. And for years, interferon was the main drug that was used. It was a drug to kind of work alongside the immune system, but there were a lot of side effects. Now there's some other drugs. Another drug that's been effective for hepatitis B infection is a drug called Adefovir or Hepzera. And you have to do a really careful assessment for liver damage before giving this drug. So make sure the person does not have jaundice. You want to look for yellowing of the skin and the whites of the eyes before this drug is administered. Thankfully, we don't see as much hepatitis B infection in this country because the people who are at risk, healthcare workers and newborns, there used to be a surprising number of hepatitis B infections that were passed on during pregnancy and childbirth because it is a bloodborne pathogen. And now hepatitis B vaccine is given routinely to all healthcare workers, and it's the first vaccine given after birth. And a lot of people think that that vaccine is unnecessary because I've heard people say, well, my kid's not going to be out turning tricks or shooting up drugs. And that is true, but traditionally one of the largest populations throughout the world, more in developing countries than countries with access to Western medicine, but many, many babies have been infected with hepatitis B in utero and after birth. And even today, it's, like we said, it's a bloodborne pathogen, and it is easier to pick up than the average viral infection. If, kids are always getting boo-boos and bloody noses, and all it takes is for one child to be exposed to the blood of another child who has hepatitis B, and it can happen at the daycare center. Kids bite each other, they cut themselves, they're not very picky about their hygiene, small children, so the vaccine really is the best way to prevent Hep B infection. Hep C infection is also considered to be a bloodborne pathogen, and up to now there was no cure for it. You treated it with interferon and other medications. Recently, an agent was introduced called Ledipasvir combined with sofosbuvir, and it's a mouthful. And now this tablet is said to cure hepatitis C infection. It actually clears it out of the system. Of course, it's very expensive here in this country. It can be produced very inexpensively in other countries, but here it will set you back quite a bit. But people have been cured of Hep C from using these medications. I'm going to stop right here before we start talking about HIV and antiretroviral agents, because it's pretty complicated, and I have some other things from YouTube that I want to upload, but we'll get back to talking about antiretrovirals.